Angiotensin-converting enzyme inhibitors, or ACE inhibitors, are a group of drugs used to treat hypertension and systemic heart failure. They suppress angiotensin II formation by inhibiting angiotensin-converting enzyme, causing vasodilation. The reduced blood pressure lowers the heart's workload. Being a systemic drug, they have multiple adverse effects. Let's learn more about ACE inhibitors through this brief visual mnemonic. Who wouldn't like to win in poker? We're back in Vegas, where a dad has just won with his hand of aces. The aces here should remind you of the ACE inhibitors. You know, ACEs for ACE inhibitors. ACE inhibitors are a class of drugs that work by blocking or inhibiting ACE, which is short for angiotensin-converting enzyme. Now that we've anchored ourselves to the ACE inhibitors, let's explore the rest of this scene to learn more about how these drugs work. Next, take a look at the pearl necklace on our casino hostess. Since casinos rake in money, it's only fitting that the hostesses wear opulent pearl necklaces. By the way, the pearls here should help us remember that ACE inhibitors have drug names ending with pril, as in captopril, lisinopril, benazepril, enalapril, and ramipril. Since the drug ending pril sounds like pearl, doesn't it? Now let's review how ACE inhibitors actually work. Take a look at our little guest at the table, this man's daughter dressed like an angel with 2 wings. She seems sad about something and is trying to get her father's attention. This 2-winged angel should remind you of angiotensin II, since angel sounds like angiotensin, right? ACE inhibitors work by inhibiting ACE, or angiotensin-converting enzyme, from converting angiotensin I to the more active angiotensin II. Therefore, you could say that ACE inhibitors directly reduce the levels of angiotensin II. Angiotensin II is a potent vasoconstrictor and also stimulates aldosterone release, which both play a big role in increasing blood pressure. Therefore, ACE inhibitors can play a key role in reducing blood pressure, as we'll see later. For now, just let this little angel come to mind to help you remember ACE inhibitors decrease angiotensin II levels. Alright, did you notice the unusually long braids of the hostess? The braids and pearls come together to complete a distinctive look. You bet that these braids also stand for something in this scene, which happens to be bradykinin. Braids for bradykinin, get it? This should help you remember that ACE inhibitors can increase bradykinin levels. You see, angiotensin-converting enzyme, or ACE, normally degrades or breaks down bradykinin. But ACE inhibitors suppress this degradation, leading to increased bradykinin. Bradykinin accumulation can lead to side effects like cough, but we'll get to that later. Psst, on a side note, this increase in bradykinin levels is a high-yield testable difference between ACE inhibitors and angiotensin receptor blockers, or ARBs. These drugs may seem similar by both blocking the effects of angiotensin, but only ACE inhibitors leads to increased bradykinin, and not ARBs. That's because bradykinin breakdown is only affected by the enzyme ACE and not by the angiotensin II produced by ACE. Got that? Let's move on. Now that we've covered the mechanisms of ACE inhibitors, let's talk about their clinical use. Take a look at that deflating pool ring around the daughter's waist. That must be why she is trying to get her father's attention. This deflating pool ring acts as a clue for decreasing blood pressure, which is the key clinical use of ACE inhibitors. Basically, ACE inhibitors are first-line agents for treating hypertensive or high blood pressure. ACE inhibitors like lisinopril lower blood pressure by blocking the formation of angiotensin II, which prevents angiotensin-mediated vasoconstriction and also reduces production of aldosterone. This decreases systemic vascular resistance and decreases blood volume, which both play a role in decreasing blood pressure. Just remember this deflating pool ring to remember that ACE inhibitors may be used to decrease blood pressure in patients. So why isn't our father paying attention to his daughter? Well, you could say he might be a bit distracted by our hostess with the pearls and braids. You can even see the dad's heart beating out of his chest. This heart should remind you that ACE inhibitors like lisinopril are useful in the treatment of heart failure. The reason why ACE inhibitors are useful in heart failure has to do with the inhibition of vasoconstriction and lowering of blood pressure we just talked about. You see, by lowering blood pressure, ACE inhibitors decrease afterload that the heart has to pump against, therefore lowering the work of the heart. Lowering the work of the heart over time inhibits tissue growth and remodeling that normally goes on to cause problems like impaired filling or arrhythmias. This cardioprotective effect is so significant that ACE inhibitors have been demonstrated to reduce mortality in patients with heart failure. Let me repeat, this is high yield. There are very few drugs that actually work to reduce mortality in patients, and ACE inhibitors are one of them. You will see this on the boards, wards, and beyond, so just remember that you can use ACE inhibitors in heart failure. Next, take a look at that jelly bean-topped dessert the host has brought to the table. You know how they always bring sweet treats to casino tables to distract the players and make them play longer? Well, the kidney-shaped jelly beans on top of this dessert should help you remember that ACE inhibitors have a protective effect on the kidney. Get it? Since jelly beans are shaped like the kidney, right? It's generally believed that ACE inhibitors have a protective effect on the kidney as they induce vasodilation of the efferent or exiting arteriole of the glomerulus, which decreases intraglomerular pressure and the glomerular filtration rate, or GFR. This reduction in intraglomerular pressure prevents glomerular remodeling and damage seen in diabetic neuropathy and in hypertension, reducing the risk of chronic kidney disease. So we've covered the various clinical uses of ACE inhibitors. Let's move on to discuss the side effects. The first side effect we'll talk about is hypotension, symbolized by this deflating pool ring here. I won't dwell too much on this, as we've already talked about how ACE inhibitors are used to lower blood pressure to treat hypertension. It should be obvious then how we could go too far in the other direction and induce hypotension, or low blood pressure. Let's move on to the more interesting side effects, shall we? It appears that our hostess is enjoying the attention, as she makes a photogenic duck face. By the way, her duck face here accentuates her lips and mouth, which should remind you of angioedema, a potential side effect of using ACE inhibitors. As we discussed earlier, ACE inhibitors increase bradykinin levels, and this bradykinin in turn causes leakage of blood vessels that creates edema around the lips, tongue, and eyelids. Rarely, angioedema may develop into laryngeal edema, which can compromise the patient's airway and cause respiratory failure and even death. In patients who experience angioedema, ACE inhibitors should be stopped immediately and replaced with another antihypertensive like ARBs. Next, notice how our man at the table is coughing nervously. This should remind you of another side effect of ACE inhibitors, development of a dry cough. Again, this is related to increased bradykinin levels, which are thought to induce cough when they accumulate around the airways of the lung. Cough is an extremely common side effect of ACE inhibitors and is a common reason why patients do not tolerate the drug in the treatment of hypertension. This makes cough pretty high yield to remember for test day. Now, notice how the dessert our hostess has brought includes bananas. By the way, the bananas raised on this dish here should remind you of hyperkalemia, since bananas are rich in potassium, and hyperkalemia just means having too much potassium, right? Specifically, ACE inhibitors indirectly reduce aldosterone levels, leading to increased potassium retention by the kidney. This can potentially lead to hyperkalemia and is especially common in patients also taking potassium-sparing diuretics or patients with renal insufficiency. Lastly, notice the tarantula on the casino table. Since Vegas is in the desert, this tarantula must have gotten in from the outside. This tarantula should remind you that ACE inhibitors are teratogenic, or tarantulagenic, if you will. This means that ACE inhibitors should be avoided during pregnancy. In particular, the product of ACE, angiotensin II, is essential for the development of the kidney nephrons, especially in the second and third trimester of pregnancy. Lower levels of angiotensin II can therefore lead to fetal kidney defects. Just remember this tarantula to remember that ACE inhibitors are teratogenic for test day. Alright, we're done here in the casino. Let's quickly recap what we've learned. ACE inhibitors are a class of drugs that work by inhibiting ACE, which is short for angiotensin converting enzyme. These drugs all have names ending in pril, including lisinopril, enalapril, ramipril, captopril, and benazepril. ACE inhibitors have two mechanisms causing their effects. First, they prevent conversion of angiotensin I into angiotensin II by ACE. Second, ACE is also used for bradykinin breakdown, so ACE inhibitors can increase bradykinin levels. Reducing levels of angiotensin II decreases blood pressure by way of reducing vasoconstriction and reducing aldosterone release. This can be helpful in the treatment of hypertension, although high doses of ACE inhibitors can go too far the other way and induce hypotension. By reducing systemic blood pressure, ACE inhibitors reduce the work of the heart and are therefore useful in the treatment of heart failure. In heart failure patients, ACE inhibitors are first line because they confer a mortality benefit. ACE inhibitors also have a renoprotective effect, which means that they can protect the kidneys in patients with hypertension or diabetes. Besides the hypotension we already mentioned, other side effects of ACE inhibitors include angioedema and the development of a dry cough, both of which are related to increased bradykinin levels in the body. ACE inhibitors can also cause hyperkalemia by reducing aldosterone release. Lastly, ACE inhibitors are teratogenic and should be particularly avoided in pregnant women to reduce the risk of kidney malformations in the fetus. And that's about all there is for ACE inhibitors. I don't know about you, but I'm ready to try my own hand at the poker table. Must be all the confidence I'm gaining from mastering my pharmacology watching Pixar Eyes. See you next time.